Business. Thanks for coming on the show today.
Thanks, Nigel.
And on to another Aussie startup, this time in the healthcare sector. If you're fed up with having to try and book medical appointments, a new website called 1stAvailable.com.au allows you to use your PC or mobile phone to search, locate and book those appointments. The man behind the idea is former dentist Dr. Rick Liu. He's given up his medical practice to pursue the business full time, and he joins me now from our Sydney CBD studios. Dr. Liu, thanks for coming on the show this afternoon. Now walk us through 1stAvailable.com.au. How did you come up with the idea and how does it work?
Good afternoon, Nigel. 1stAvailable.com.au was actually born from my experiences as a dentist. When I was running my busy practice, I would have times in the week where my patients would ring me and get very frustrated they couldn't get appointments to see me. As a small business, we were running a business that sold appointment time. And at other times of the week, I'd have availabilities where I had no means to publish or tell the world that I was available to be seen. In 2007, I was actually on the internet booking hotels through whatif.com actually, and I looked at the system and said, you know what, someone has to build this for healthcare, and that's what I started to do in 2009.
And as soon as I saw this idea, my first reaction was, why hasn't someone thought of this before? Now tell me, from a customer point of view or a client point of view, walk us through the process here. What do I do if I want an appointment?
So as a client, the actual service is completely free, and there's different levels of search you can do. The most generic search is a practitioner type. So say you're looking for a dentist in Sydney CBD and you want the first available appointment, that's what you'd specify, and our system will actually serve back the appointments for any dentist in the CBD that matches that response in order of time. The second thing you could do is you can actually search for a specific practice, and if they are a subscriber of ours, we will serve up their available appointments. Or you can go all the way down to an actual doctor. So if you have a specific practitioner that you see, you can also do the same thing and search just for their appointments. Searching is free. When you go to book, it's also free. The only thing we ask our clients to do is to confirm by registering and logging into the system, because healthcare appointments are a valuable thing and we just need to check to make sure they're real people.
So Dr. Liu, if you ask clients to register for free, is there any charge for the practitioners on the other side of the equation?
Yeah, so 1stAvailable derives its revenue from actually a subscription that we charge to practitioners. So they pay a monthly fee to be part of our service and have the ability to publish their appointments online through 1stAvailable.com.au.
And you have plans for a mobile app as well?
Yeah, so our mobile app's actually in development right now. It's planned to be released to the Apple Store and Android this week and should be available in the coming week.
And tell us, Dr. Liu, if someone doesn't turn up for an appointment, is there any kind of cancellation fee here? Are they held accountable in any way?
1stAvailable.com.au tends to not involve itself in the actual appointment with the provider itself. So we tend to think of ourselves as a lead generator. So we don't charge a cancellation fee as such, but each practice in surgery may have a cancellation policy that they may or may not enforce.
And how do you intend to really incentivise these practitioners to sign up? I understand you've got over 1,000, but the success of this business depends on having as many as possible. You are charging them a fee. What is the incentive to them?
We haven't had any pushbacks from the practitioners themselves. Our most common reaction, as you said earlier, was, hasn't someone done this before? And then the second most common thing that the practitioners say is, it's just logical, everything's going online. So our practitioners are actually getting the message very, very clearly, and most of them see this as just an add-on to their business.
I definitely do agree that it is very much like What If, and it is bringing much needed technology to the healthcare sector. Dr. Liu, thanks for coming on the show this afternoon.
Absolute pleasure, Nigel. Thank you.
And after the